Hi and Assalamualaikum. My name is Muhammad Ikmal Hanif. Okay, so we meet again for another chapter which is a drug therapy on gout. So first of all, on this case, we will focus on what is gout, how it occurred, okay, and what is the treatment that available for this particular diseases, right? The best thing we need to remember that gout is a metabolic disease. What is gout?
What is
Gout
gout?
is referring to
Right?
a
Gout is
condition in
referring a
which we
condition
call
we
them
call
as
as
hyperuricemia,
in
this is
which
referring
high
to
level
6
of uric
milligram of
acid
urate
within
okay,
the
uric
blood,
acid within the blood
right?
per
So the urate is liters,
more than 6
right?
milligram per
And gout
deciliter.
is known, as mentioned
And this
before,
is
a
also known
metabolic
as
disease,
a
which is the
metabolic
uric
disease
acid
for the gout,
or urate
alright,
crystal
in which the
deposited
uric
on the
crystal are
synovial tissue
deposited
of distal
within a
joint.
tissue. So that's why
Okay,
we
to
feel
be specific,
pain
in our
or numbs on
synovial
that
tissue of
particular
distal
area.
joint. So that's why
Alright,
people will
and
feel
this
pain on the
symptoms
joint. Alright,
actually
most common
you can
within
notice
on the
it by
feet.
the intense
Alright,
pain
but
on the joint itself.
we need to
Right, and then in
understand
terms of the
inflammation,
symptom
a
of the
red
gout,
hot
alright,
inflame
is an
intense
area on
pain
the
for a
distal joint,
prolonged time if
and this
not
condition
treated.
is
Okay, I would say that
in
in
which
general
the
can
area
be
it
happen in
feel
two ways.
one
Hot,
of it
something like
commonly due
inflammation,
to
and the
hereditary
pain
disease,
are extremely
okay, from a
intense.
family background. This is number
Okay,
one,
what is
and number
gout?
two is
Right,
acquired
gout is
throughout
referring a
a poor
condition we call
dietary
as
intake, such
hyperuricemia,
as
in which
high
high
intake of
level of uric
alcohol,
acid
alright,
within the blood.
and excessive
Alright,
amount of
so the
high
urate
purine
is
foods
more than 6
on
milligram per deciliter.
during the eating process. And this is
Okay,
also known as
so
a
although
metabolic
this is
disease
very
for the
painful
gout,
and can be
alright, in which the
acquired,
uric
we
crystal
have
are
several
deposited
ways to
within
treat
a
the
tissue.
gout.
Okay,
Okay, to be
generally
specific,
we
we
have
have our
allopronals,
synovial
okay,
tissue of
probenzoic
distal
acid,
joint. So that's
and
why people will feel
colchicine.
pain on the
Those are
joint.
a
Alright,
three that we
but
will
most
going to
commonly
cover
on
on
the
this
feet.
session.
Alright,
There are two types of gout. Alright, number one we call them as acute, means it's quickly to occur, and number two is chronic. So the acute one, alright, there are numerous a few ways how it occurred, but the most common is due to high intake of alcoholic beverage. Alright, it's high intake or excessive. Okay, same goes with the high intake of purines in food. This may cause a acute gout, okay, which is one of the two type of gout. Second is a chronic gout. Okay, chronic means it takes times to occur, right? One of the reason someone having a chronic gout due to genetic defects, okay, and then renal deficiency, and then Leach-Nymphen syndrome, and lastly excessive uric acid production associated with chemotherapy treatment. Okay, those are a few. There are two type of chronic gouts, and the reason how we classify them into acute and chronic. Treatment for gout. Okay, we do have three type of drug that we're going to discuss on this session. Number one is allopurinol. Number two, urocosonic agent, and third is colchicine. Right, the two of three named treatment, which is allopurinol and uricosonic agent. This one is very suitable for treatment on chronic gout. For the acute one, we always go for the colchicine, right? Allopurinol. Okay, allopurinol is one of the drug that suitable to treat chronic gout. Okay, so for this session, we will discuss on how it work or the mechanism of action. Okay, so allopurinol itself is a non-competitive inhibitors. Okay, so what they did is how it does is like this one. Allopurinol is converted into alloxanthine by xanthine oxidase. Later on, alloxanthine, which is a non-competitive inhibitor, then inhibit the xanthine oxidase. Without active xanthine oxidase, hypoxanthine, which is a naturally occurring purine in the body, will not be converted to xanthine. Then, without xanthine, which is cannot be converted, okay, non-active one, so the xanthine is not converted to the uric acid. So this is how the uric acid production can be reduced. How well effective allopurinol is, however, they do come with some adverse side effects, okay, which is namely they are gastrointestinal disturbance, allergic reaction, and the worst it can be toxic epidermal necrosis such as TAN, which is toxic epidermal necrosis. They are extremely potential to be our life-threatening threat. Okay, but however, the toxic epidermal necrosis is not really common, but based on individual. Alright, but the rest is such as allergic reaction and gastrointestinal disturbance may occur. Okay, it may occur. It's not necessarily you get it once you get allopurinol. Second type of drug, which is uricosuric agent. Okay, to be precise, that there are two types. Okay, what we call as probenecid and sulfenfirazone. Alright. So this type of drug is actually they help to increase uric acid excretion via a direct action in our renal tubular. Which means when you take this one, okay, definitely you need to take a high intake of fluid, okay, to help excretion through urination. Alright, and this type of drug, they are actually a weak organic acid, promote renal clearance of uric acid by inhibiting the urate anion exchanger in the proximal tubular within our kidney. Alright, and then it mediate and reduce the urate reabsorption, okay, within the tubular. Okay, you can see the diagram here. Okay, it increase secretion and excretion, okay, throughout urination, and they decrease or inhibit reabsorption of the urate, so preventing the urate to go back to the blood circulatory system. Okay, and this type of drug also do have their adverse effects. Okay, so the most common is rashes, gastric distress, okay, flushing, dizziness, and headache. Okay, I would say that this is kind of mild type of side. Although this is I would regard as a mild side effect, but a few things you need to be aware of. Okay, number one, if you are an allergic to the probenecid, okay, you should not take it. Okay, if you have blood problem and kidney stone caused by uric acid, okay, because the renal will do extra work to remove it. Okay, and then third is that if the patient you want to give is a child or younger than less than 2 years old. All right, and last but not least, if you are taking salicylates, okay, example aspirin, do not prescribe this drug. Okay, last but not least, the third type of the drug, which is colchicine. Okay, the diagram here show you the flower of the colchicine. Okay, so colchicine is a plant alkaloid, okay, which has been used, okay, for acute gout and a chronic gout. So for your information, colchicine is neither uricosuric or analgesic agent. Okay, although it provide relief pain in acute attack of the gout. And that need to be noted that, all right, colchicine does not prevent the progressive of the gout. Okay, but it does have a suppressive and prolytic effect that reduce the frequency of attack of the acute gout and the relief of pain. So colchicine can usually be administered for a person who have a gout attack less than 12 hours. Okay, and the impact of it will reduce the attacks led up to 80%. Okay, the frequency of the attack by the gout. So that is the best part about the colchicine. So how does it work? As mentioned before, colchicine does not prevent progressive of the gout. So what they did is that mainly it binds to the tubulin in the cell, affecting to the cell division, and then they inhibit the function of leukocyte, inhibiting chemotatic factors from being released from that particular area. Okay, and inhibit inflammation, some of interleukin-1 production, and inhibit release of histamine from the mast cell. So all these cells been mentioned and chemotatic factors are the main factors that cause migration of our immune system to that particular location, which is cause a numbness, warm or heated on the localized area, and painful, what we call as, this is what we call as inflammation. Right? So what the colchicine does, it block all of those. Okay, that's why it managed to provide, I would say that quite fast pain relief on that particular location. Okay, it provide a pain relief. However, they have several type of no several kind of adverse effect. Number one is nausea, okay, vomiting, abdominal pain, diarrhea if you take a large dose, okay, gastrointestinal hemorrhage if you take colchicine for prolonged treatment, kidney damage again for a prolonged treatment, and even bowel marrow depression. Okay, so colchicine is a great pain reliever, but do not take it for the long time, which is the side effect is quite numerous. This is the last slide. We have come to our end about gout. Alright, so based on diagrams, okay, it shows that when you take in food, high intake of purine or alcohol, so what happens is that cell breakdowns, okay, and produce a lot of purines. And this particular purines later on, high intake, we're talking about high intake or excessive intake of alcohol or purine in diet. Okay, it causes a production of increased production of uric acid and crystal deposition in the tissue and cause gouty arthritis. Okay, the intense pain. Okay, so all the drug that we mentioned, we only cover for three, which is allopurinol, okay, uricase, and probenecid. Alright, so allopurinol, the blocks in the early stage under the production of purines. Okay, this is a non-competitive inhibitor. Alright, and the second part is that uricase is breakdown of uric acid. Okay, after uric acid formation occurred, they break down. And again, another group is probenecid acid, which is excess excretion of uric acid again being reduced throughout our urinary system. Okay, last but not least, such as colchicine, is reduced degree of inflammation. Again, the progression still occurred. It just reduced the pain that being felt during the process. So this is the overall or the summary regarding a gout and that pharmacological treatment using three type of drugs. Number one, namely allopurinols. All right. Okay, uricase on probenecid acid, and lastly, we discuss about colchicine. All right, that's all from me. Thank you for watching and hearing.